I had one about determining the BP, blood pressure, but like diastolic blood pressure of the child.
The formula to calculate.
Yeah, no, the formula, I'm confused because some places I read it as 60 plus 2 and some places is 60 plus n. Some places it's half, some places it's 1 by 3.
Okay, I'll write at the chat. So systolic. Doctors, what do you think about it? About formula to calculate the blood pressure, systolic blood pressure?
Systolic is 90 plus 2 n. N is the age of the child.
Yes, and diastolic? Doctors, yes, 60 plus n. Yes, that's right. So this is not difficult, I think. Okay, just remember it. Okay, if you have any questions more. And what about the sounds? Did you hear it? So which age we use this formula? About blood pressure. Hello. Formula about blood pressure. We use it in children older than 1 year. Hear me? Hello. Oh, good connection. Okay. So older than 1 year up to 18 years. Okay, can you see my screen now?
Yes?
Yes.
Okay, so let's try to do some ticket. So what about this question? What do you think?
This about the submandibular lymph node, yeah? The first picture.
This is palpation of lymph nodes.
Yeah.
Okay. And which groups?
We have submandibular, submental,
Submental, anterior,
subclavicular, thoracic,
axillary.
cubital.
Okay, and what lymph nodes are not palpated in normal?
Like inguinal
Inguinal?
Yeah, inguinal. Sorry.
No.
Then abdominal.
Doctors, where are you?
Ma'am, I think it's auxiliary and thoracic.
No, axillary, we can palpate normal, or very often, just normal.
You're asking what are palpated in normally palpated.
Now I'm asking you about lymph nodes that are not palpated in normal.
In this
No.
picture, from these pictures.
Not in this picture. At this picture, we are can see the lymph nodes that can palpated in normal at this picture. And I ask you about another lymph nodes that are not palpated in normal.
Supraclavicular.
Look, at this picture also we can see this. I'm sorry, yes. Okay, so, yes, Prima. So, what lymph nodes are not palpated in normal? At this picture, yes, you're right. At this picture.
Ma'am, you mean
I think-
cervical?
Okay, okay. Let's answer this question. Which groups of lymph nodes are palpated in normal? Okay, that will be right and correct.
Auxiliary, thoracic, maybe cubital.
Look, let's see at the first photo. So the first photo shows us the palpation of the submandibular, yes? Lymph
Yes.
nodes. So what do you think about it?
We can't usually palpate it because it's not visible unless there is some defect.
No, and students that were with me in the previous cycle, you have to know it because we wrote it, we discussed it, and this information you have in the book also. Tonsillar at the first photo, or submandibular is the same, yes? So these lymph nodes palpated in normal. We can palpate. For example, what does it mean in normal? If the patient don't have some oncological disease, for example, lymphoma or lymphogranulomatosis, but there are some lymph nodes that are not palpated in normal because if we find it, we can say that this patient can have some oncological disease. Okay, cases. So not palpable in normal condition. Submental, subclavicular, intraclavicular, epifocal, pectoral, and popliteal.
Can you repeat them again, please?
Just look at the chat, please. Casey wrote it. So, but, okay, that's right. At this slide that we can see in our computer, yes, in our monitor, The question is, which groups of lymph nodes are palpated in normal at these 7 groups? What do you think? Okay, so photo number 1 is normal.
Number 6.
What? Yes. So photo number 1 is normally palpated. Yes, that's right. Then photo number 2.
Not palpated.
Not
Not normal.
palpated. Yes, not palpated. Number 3.
Palpated.
Not palpated.
Why? What group of we can see at this photo?
Cervical.
Anterior cervical.
Sternocleidomastoid.
Yes, cervical, anterior cervical, and also it is or there are posterior cervical. Yes, these groups we can palpate in normal. So number 3 also normal. Yes, normal. Please look at the chart in the Zoom. Casey wrote not palpable in normal condition lymph nodes. So number 3 is normal. Then number 4. Yeah.
No.
Tell me how it named.
It's subclavicular.
Yes.
Thoracic.
Not thoracic. Thoracic at the photo number 5. And this how named subclavicular. Yes, Mama, that's right. So subclavicular. Then so subclavicular is not normal. 5.
It's normal.
How named it? How called it?
Thoracic.
Thoracic.
Thoracic, but thoracic is not normal. Also, thoracic or pectoral, yes, it is the same.
Okay.
Then next.
This one is normal. It's
normal.
axillary.
Axillary.
Axillary lymph nodes, yes, normal. Then number 6 have 2 photos. Okay, and number 7 have also 2 photos. How called these lymph nodes?
Cubital.
Cubital. Yes, cubital or look, epitrochal. This is the same. Yes. So one more time, please answer the question. Which groups of lymph nodes are palpated in normal at this slide? Number
1,
4, 5.
3,
1, 3,
6,
and
7.
6. 7, no. This is cubital lymph nodes. They are not palpated in normal. So only 1, 3, 6. Okay. This question, the depth of compression during CPR at teenager.
5 centimeters. 5 to 7.
Doctors, what do you think? Another doctors. Jumana, what do you think?
5 to 6 centimeter.
Teenager. And in newborn. Oh, please. I think it is to microphone.
Yes.
Mhm.
For adult,
Newborn.
5 centimeter.
Newborn.
That to 2 centimeter.
Mhm. Okay, next question. Evaluate the condition of the skin, name the disease or pathological condition which is characterized by such changes. So what do you think about
Scarlet fever.
Very good, very good. And please name the all photos that you can see. So, and the photo number 1.
First,
what we
strawberry tongue.
Yes, strawberry tongue with white plaque. Yes, with white plaque in the acute phase of the scarlet fever. Then number 2.
Pale nasal. Violative mask.
What?
Nasolabial.
Yes, yes, yes. So the pale, pale nasolabial triangle or filato, yes, symptom, filato symptom. Also with highlights, yes, highlights, and a strawberry tongue, but without plaque, yes. Then number 3, we discussed it.
Dermographies.
Yes. What dermography? What type of dermography?
White.
Sympathetic.
Of course. White. Why? We can see white dermography.
Hyperactivity of sympathetic nerve.
Yes, hyperactivity of the sympathetic nervous system in the acute phase, yes, of the scarlet fever. Okay, then number 4.
Rash.
Yes. Scarlatino's skin rash, yes. What morphological elements of the skin rash you can see?
Small maculars. Maculars.
No, maculopapular.
Macular, most often macular, yes. Scarlet maculopapular example.
Fine maculopapular. Very fine.
Fine, yes, fine. Okay, then number 5. Okay, let's rapidly. Number 5.
Pastille line.
Pastilles line. And number 6.
Disclamation of skin.
Disclamation of the palms, yes, in subacute phase of the scarlet fever. Okay, very good. Analysis. What do you think about it? Rapidly.
It's muddy. And there is protein. We can see hyaline cysts, hyaline cylinders.
So what does it mean?
First of all, we have proteinuria. So maybe nephrotic syndrome.
Yes, very good. Yes. So proteinuria. Also, we see hyaline cylinders, also protein cylinders. Yes. So that can be, of course, nephrotic syndrome, and the disease that we can suppose disease. This is syndrome, okay? So nephrotic syndrome and disease. What disease we can observe nephrotic syndrome, doctor?
Glomerulonephritis.
Of course, glomerulonephritis. Of course, yes, Juman, glomerulonephritis. Okay. Also, you will have the sounds, but now I can switch on this. So, what about the sound, doctors? Did you hear it? Have you any questions about sound of the heart and of the lungs?
How are the heart sounds going to be?
I sent it to the chat, so you have it. I can send it one more time.
Can you give us an example of how
with the answers? Standard. Good. I hear it, but all sound almost the same.
Yeah, this.
It's like
Okay, let's. Yes, but this is not the same. Okay, let's see. Where is it? First tickets, and then we can. I think we can hear the sound. But now you can you hear the sound now?
yes.
Yes. Good.
Yeah.
I don't
But-
hear it.
So,
From you, no,
do
we
you
don't
hear
hear.
it? Tell me. Huh?
we can't hear the pulsation clearly?
Not clearly.
Unfortunately not.
Tell me, please, if you hear it clearly or no. It is important.
Очень... Yeah.
No?
Very low, like, не слышно.
Не слышно, да? Okay, so at first we return to the tickets, okay, and then we will thinking about sounds in another place. I think we'll look at,
How many questions will be in one ticket?
5.
Oh, okay.
So please look at this. It is not difficult if you know it.
No, this is pancreas. I think pancreas palpation.
Pancreas at the left side. Yes, you are right. So pancreas. Let's remember the points and the regions of the pancreas.
I think second one is Mayo-Robson.
Mayo-Robson. What
On the upper quadrant. Tail of the pancreas.
Tail. Yes, tail of the pancreas. Okay, very good. And photo number 1 is not so clear, yes, but
yeah, it's not.
I think it means
head of pancreas.
The head, yes, or the pancreas.
Yes.
The head and the body of the pancreas. So, what zone?
Shofar.
Yes,
Shofar.
Shofar zone. Very good, Primo. Very good. It's great. Okay, then next question. So this is question about emergency condition. This is about health. Okay, but questions about emergency conditions you have, the answers you have in the presentation, and I sent this presentation to the chat in WhatsApp. Okay, about emergency conditions. All questions you can find at this presentation. Okay, now determination of the pulse of the child after. In what artery you will?
Bronchial artery.
Bronchial. Very good. Very good. Okay, this.
This is meningococcal infection. Meningococcal.
Yes, that's right. So this is hemorrhagic skin rash in meningococcal. And at the first picture, what we can see?
It was called something orthostenos or.
Yes, that's right. Look, opisthotonus.
Yes, opisthotonus. Yes,
yes, I told you opisthotonus. Yes, opisthotonus. Okay, just write it and then, because we know we have a lot of time. Then this analysis.
Excuse me, Professor.
Yes.
Can we record this class for those who didn't attend?
No, record no. Just remember it, okay?
Okay.
And you have a paper and a pen. Pencil. Iskandar, yes. So, yes. So, Iskandar wrote, no, just Iskandar, not please stop the record, okay? Because it will be not right. It is not difficult questions, only 5 questions. You all know it. Yes, what do you think about this analysis? So rapidly.
There is hematuria.
Yeah. Okay.
Yes, hematuria, a lot of erythrocytes in the urine, also look erythrocytic cylinders. So this is hematuria. What syndrome it can be?
Nephrotic.
Yeah.
Sorry, nephritic. Sorry.
Nephritic. Right.
Nephritic or nephritic, yes, nephritic, and the disease, one more time, the same.
Glomerulonephritis.
Of course, glomerulonephritis, because the glomerulonephritis can lead nephrotic or nephritic syndrome. In some cases, it can be both syndromes in glomerulonephritis, but it is rare. Okay, next.
Excuse me, ma'am. Aside from the ticket, what other questions are we going to have?
What questions? One more time.
I mean, aside from the ticket, you just showed us how the ticket will be like tomorrow. And aside from the ticket, what other questions, what other extra questions are we going to have? Is it a pulsation or scripture?
No, that's enough. If you ask about this, only these questions you will have. Or you ask me about what?
Yes, that's it. Thank you.
So this, what kind of research does the doctor do?
Isn't spleen location?
Of course, palpation on the spleen. So is the spleen palpated in normal?
No.
No. Of course, yes, no. Then, next question. Expression of a foreign body in a teenager.
Heimlich maneuver.
What maneuver?
Heimlich maneuver.
Okay, Heimlich maneuver, okay. Very good. This is what?
Chickenpox.
Of course, chickenpox. Yes, that's right. This is likely, yes, for you. So, tell me please, what does it mean, false polymorphism on the skin rash in chickenpox?
There is a lot of lesion at the same time.
Different types of rash.
Different lesion at the same time.
Very good. Next, then
This is normal analysis.
so
This is not.
Prima thinks that it is normal. In other opinions,
Absolutely no.
normal. More.
Normal.
Are you agree? Normal. Okay, normal.
Yes.
Okay, next. Let's work rapidly. So, frequency of respiratory movements by age, 1 year and 5 years.
1 year, I think 30, 35,
Mm-hmm.
5 is 20,
And 5 is
25.
20 to 25.
Very good. What kind of research does the doctor do?
Percussion of spleen, I think.
Yes,
Or finding the
percussion of
borders of, yeah.
Uh-huh. So tell me, please, the sizes of length and wide, yes, of the spleen in normal.
Wide less than 2 centimeter.
And length?